One thing I absolutely love is doing kind of case studies when people ask me complicated questions, and I, give them a bit of a plan for moving forward and healing their body. So today the case study is around somebody who recently had neck surgery, but this little protocol that I'm giving her is also appropriate if you have like an injury, a whiplash injury or something, you've had a motor vehicle accident, you fell off your bar stool, or you just have like chronic neck issues from sitting at a desk all day. So what I want to show you is a good place to start if you're really at the beginning place of dealing with your neck issues. So you need to think of your neck as the thing that's holding your head. So obviously head position is going to be important. We can use the head as kind of a weight to get our neck muscles strong and healthy again. And then we also have to think about the neck as being sort of an extension of the core, right? Because the neck and spine, obviously part of the core. So we need to think about things like our pelvic floor, how we activate our core, and getting the neck functioning again as part of the spine. So functioning on its own, yes, as carrying the head around and allowing movement, but also as part of the core. So I want to show you a few exercises, even some breathing techniques that are going to help you restore how your neck functions. And it gives you a good place to start. You can always add challenge and more difficulty as you feel stronger, but this is a really good place to start. So let me show you what I've got for you. All right, let's start with some self-resisted isometric holds. These are really great exercises because they're appropriate even in early stages of healing. So even if it's a pretty recent injury, surgery, etc., you're always going to wait for the go-ahead from your surgeon or somebody or your doctor or whatever, whoever you're seeing, to go ahead and start challenging your neck muscles. But this is the ideal place to start. Most rehabilitation protocols would include some form of isometric exercise like this. So this is very, very effective in helping reduce fear and apprehension for movement and restoring some range of motion and comfort in your range of motion. So let's begin. We're going to first of all bring the heel of the hand up against the temple bone. And you're going to, without letting your head move, because your hand's there, you're going to think about bringing your ear to your shoulder. Okay, so I'm going to try to move in that direction. I'm trying to tilt my head to the side so I can bring my ear to my shoulder. So that's what I'm thinking about, and that's what I'm trying to do with my muscles. So I would take about 3 deep breaths there, and then when I've taken 3 deep breaths, and they're slow, calm, full deep breaths, so your nervous system knows you're perfectly safe, then you would ease up, remove the hand, and allow your head to just move there. I'm not going to try to stretch anything. I just want to see, will my ear move toward my shoulder? Because that's a nervous system thing. Okay, and then we can bring the head back. Now you can repeat that a few times if it felt really good and you notice some increase in your range of motion, or you could just do it one time until you feel like you want to do a bit more. You feel like you're ready for that. Okay, let's do it on the other side for practice. So I'm going to think about bringing my ear to my shoulder, but I'm not going to let that happen because my hand is stopping me, okay? But I'm trying, all right? My muscles are turned on. My brain is thinking, get your ear to your shoulder. And I'm going to take 3 nice full deep breaths, keeping my nervous system calm. And then I'll ease up and I'll see if my ear will move to my shoulder. Now this part is really important. You want to just spend a moment here feeling what this feels like. So your nervous system knows that you can bring your ear towards your shoulder and it's perfectly safe. Nothing bad happens. That's a really important thing for your nervous system to know. So once again, you can repeat that and go back and forth if you want, however you want to do that. But we want to activate, hold the isometric hold, and then see if we've been able to increase our range of motion. It's a temporary effect. You have to keep practicing it, but it's something you can practice every day. So let me show you a second technique, and this is for rotation. Kind of works the same way. We're going to bring the heel of the hand up against the temple bone. And now we're trying to rotate. So I'm thinking I'm bringing my nose toward my elbow. And again, I'm not going to let that happen, but I am trying. I'm using the muscles in my neck that would turn my head to the side. And I'm just going to take 3 deep breaths, again, keeping my nervous system calm. Everything's fine. I'm totally in charge here. I can stop at any time. And then I'm going to ease up on that and allow my head to rotate. And you might find, wow, I actually get a lot more rotation. So let's try it on the other side. We're putting the heel up against the hand. I'm thinking, turn my nose toward my elbow. My head's not going to move anywhere. My hand's not going to let it. I'm taking 3 deep breaths, keeping my nervous system calm and settled and happy. It's good to let yourself feel what the muscles are doing. And then I'll ease up and I'll just allow my head to turn to the side like I've been trying to do all along. And you'll probably find that your head almost floats over there. When it's good to, once you're there, just stay there for a breath or two, feeling what that feels like. That is how you tell your nervous system, all right, you can remain calm. It's fine to turn your head like that. We can start doing that again. Okay, so it really does reduce apprehension. It also has the added benefit of reducing pain sensitivity, because the more your nervous system knows about what you're capable of, then that really reduces your pain sensitivity. So this is really worth trying. You can do it every day. So check out the other things that I have for you. All right, so now I'd like to show you a couple of exercises that they seem like core exercises, and they are, but they're also going to be really beneficial for your neck. One thing you need if you're going to help your neck recover from an injury, surgery, or just generalized neck pain is get your core in a better position. So we're going to give that some stimulus now, and you'll find that this is going to also be really strengthening for your neck. So first one is based on the Stu McGill curl up. It's not really a curl up, but you'll see what I mean in a moment. So we're going to lie on a mat or the carpet or something, and I often talk to my students about Mula Bandha engagement, which is a subtle engagement of the pelvic floor. We understand this to be part of our deep front line. So we can just press into our feet slightly and energize through our legs into our pelvis as though we're dialing the feet and knees away from each other. This can help you get that little bit of engagement at pelvic floor. Pelvic floor is the floor of your core. If you can work your core, you have to work your pelvic floor. All right, so we've got that switched on. Other cue I talk to my students about all the time is their pubic bone to breastbone activation. So you want to be able to, without moving pubic bone and breastbone toward each other, to activate the muscles and fascia in that sort of front shield of your body. So we're pressing into our feet, we're engaging Mula Bandha, and then we want to think about pubic bone to breastbone. This is automatically going to activate the muscles in the front of your core, probably draw the lower spine a little closer to the mat, though we do not want it pressing down. Stu McGill recommends you put your fingers under there so you actually are not right up against the floor. You're maintaining a little bit of a curve there, which belongs there. And then we're going to just tuck the chin, stay active between pubic bone and breastbone, and then just tuck the chin. Now you can simply do that. You can simply hold it here, maintaining the natural curve here, maintaining activation, and just take a few breaths. And when you're ready to move on from there, keeping everything just as it is, you might want to try lifting your head. So again, and this is for somebody who has neck issues, post-surgery, post-injury, or just really persistent neck issues, okay? Tuck your chin, pubic bone to breastbone is active, and then use one of your hands for a little bit of assistance to lift the head. We're not trying to lift it way up. We're just trying to lift it a little bit as though you're trying to look at your pubic bone. So you see how the chin is tucked? These muscles in front of the neck are very active. I'm not trying to curl my neck a whole lot, but I do want to activate these muscles in the front of my neck. You would try to take a nice full breath. We need to be able to brace and breathe, and then lower slowly and let everything relax. That part is really, really important so your nervous system knows it's safe. Okay, and then we can try another round. So I'll just say press down into your feet, engage Mula Bandha, we're pressing down, dialing out, pubic bone to breastbone active, chin is a little bit tucked, we're not trying to curl the neck. And then with or without your hands to help pick up your head just a little bit, I recommend starting with at least one full round of breath. Inhale, exhale, And then slowly return your head down and let everything relax. Roll your head from side to side. So you could see how that feels for you. You might be really done after 2 or 3 repetitions. If you feel strong enough, you can do up to 5. Let me show you another exercise. Again, you're not going to think of these as neck exercises, but because the head is kind of a pretty heavy weight, it is going to challenge your neck muscles. So see if you're up to this. Just simply going into table pose with hands under shoulders, knees under hips. Once again, look, we want to activate our pubic bone to breastbone activation. And I usually tell my students to also press down into the top surfaces of the feet so they do get a bit more pelvic floor, lower belly activation. Okay, so now we're just going to do something very, very simple for head and neck, and that is drop the head gently down, nice and slow, and then pick the head up again. And just extend the head and neck so you can look forward without being aggressive in any way. Okay, and then as we come down, we're just tucking the chin a little bit. See if you can keep the rest of your body switched on. And your breath is nice, slow, and smooth. Again, this is a very important message to the nervous system that you are perfectly safe and in charge. Okay, one more time. Elevate and you might find that now your core muscles want to do something. So we're going to incorporate them. This is more like a cat-cow yoga pose now. So we'll inhale, send the tail up, bring the belly down, shine your heart forward, and now let your neck behave as part of the rest of the spine, lifting through the crown of the head here. All right, and then we'll point the tail down, pull the belly in, cave the chest, and finally tuck the chin. So see how we're moving the neck as just part of the rest of the spine. So we'll have this spine going into extension as we move into cow. Keep the head tall, looking forward, and then going back into flexion here. Pull up through the belly, cave the chest, tuck the chin. So again, if this feels good in your body, you would start with just the head movement to see how that goes, and then do the entire spinal movement. And it's very important to do it slowly with full deep breaths. So once again, we're reducing apprehension. We want to make the body fearless and able to do these movements with confidence. All right. And then you can decide, like if 5 feel good, try 6 or 7 next time. Okay. These are practices you can pretty much do every day because they're not like super aggressive in any way. And you need to let your nervous system feel these movements once again so you reduce fear and you will recover from whatever it is that you've been through, surgery, injury, or just chronic issues. Good luck with that. All right, let's do a pranayama technique that is going to help you kind of feel like you've got your breath back. You've got a little bit more stamina in the lungs and your breathing. And it's not aggressive. It's very easy to start with, but we do want to sort of challenge and expand the diaphragm. So this is going to help us do that. So very, very simple. You can do it on a chair or any other seated position. Make sure you can have your spine erect and your head nicely balanced over your body. Even here, we want to get taller. Okay, and we'll stay tall. And we're going to elevate and depress the shoulder girdle. So just think about bringing your shoulders up around your ears and dropping down. Now to do that, you are going to use neck muscles. So it is going to challenge some of your neck muscles. So I would recommend you only do as many as you feel comfortable doing. You know, you don't want to stress out those muscles if you're just trying to heal and recover from an injury or surgery. But you do want to give them a little bit of stimulus because it really helps with the healing process. So let's try this and we'll do like a round of 20 or 30. It's in and out through the nose. And again, you have to stay tall and present, and then we might do more than one round. Okay, check it out. So we begin with inhale through the nose and exhale, drop. Check your position, make sure it's not collapsing anywhere, stay tall, heart lifted. 4, 3, 2, and 1. Let's hold the shoulders up. Hold breath in if you want. And then let go. And totally relax your shoulders now. And take a couple of regular breaths. So you'll notice that your heart rate might have elevated slightly. And of course, the rate of your breath was really expanding. So we're just going to let things return to a more neutral place. See how you feel. And then if you want, you can do another round. All right. So we're beginning with our shoulders, resting down. We'll take an inhale, elevate the shoulders, and then we'll exhale, just drop. So we just let go, up and let go. Four, 3, 2, and 1. Hold the shoulders up if you like. Hold breath in if you like. And when you're ready to let it all go, you just let the breath go, let the shoulders fully relax. And then after a couple of breaths with your shoulders fully relaxed, feel free to just do a little mobilization if that seems like your body would like it. You can just try it out. Okay, so while we're seated here, I'm going to show you one more technique. And actually, both of these techniques could be done just standing on your feet, or you could do them seated, okay? So this one involves rotation. And I would do the first one first, and if that feels really good and you're up for something more, then you can do this one, okay? We're going to be rotating through the spine, including the head and neck. So make sure that you feel your neck is ready for that. Okay, and we just start with our arms wide. Once again, it's super important to sit tall, especially going into something like rotation. So we take the breath in through the nose and out through the nose, and we thump the chest as we turn the head. Okay, so we go inhale, exhale. And then you can speed it up. So we started with like a slower cadence, but if it feels good, you're going to just speed it up. I recommend you doing this with eyes open. I always recommend a little bit of tension in the hands, so keep your fingers strong and active while you're doing this. And again, you want to just see how it goes. You might do 10, you might do 20, you might do 30. I usually count myself down. 4, 3, 2, and 1. And then I'm going to hold. And again, this shoulder action that I'm doing involves neck muscles too. So we're just going to let ourselves feel this for a moment. Let the neck muscles work for a little longer. And then you can bring the arms down and just totally relax. And now, if you want to move the head around a little bit, rotate the head, you might find that you have a little bit more freedom of movement. Of course, this has been acting on the thorax, the part of your spine that has ribs attached, and then a little bit through the belly and the low spine. So those techniques are good for your core and for your neck muscles and practicing getting taller and, keeping the head over the body in a balanced position. Good luck with that. I hope it really helps. All right, so especially those of you struggling with neck issues, I want to tell you that one of the key ways you're going to heal your body is through walking, but walking properly. Okay, so it's not going to matter if you're walking with your head in a terrible position. All those steps are actually just probably going to make your neck issues worse. So let's talk about what needs to be going on in our walking gait and our pattern so that we actually benefit from walking. Okay, so one of the first things I always talk about is walk with your feet straight. You've got to have your great toes pointed straight ahead and push off with your great toe. If you are in the habit of walking with your feet turned out, you are probably pushing your arches downward. You're moving the center of your ankle toward the midline. You could be developing a bunion. All of these things are related to walking with your feet turned out. You can also start having knee issues. That medial knee will start to cave in a little bit when you're walking. So when you walk with your feet straight, you kind of solve a lot of all those problems. You have a lot more power in your push-off as you push off that great toe, and you're going to preserve the function of your great toe, which is worth doing because it's connected to your pelvic floor function, and we don't want to have dysfunction at the pelvic floor. All right, so walk with your feet straight. That's my number one recommendation. The next one is to understand that you have these fascial planes and lines through your body, and they need to be balanced. So the best way to have a strong, healthy neck is to use your head in the right position. Your head is like an extra weight. If you have your head forward when you're walking, say you're in the habit of looking at the ground while you're walking, that is going to pull you out of position, and the fascia is not going to be balanced in your body. We have a superficial front fascial line, superficial back fascial line. They need to be operating in balance with each other. So here's how to solve that problem. You're going to imagine the pubic bone here and the sheet of fascia that comes up the front body. You want to create some tensioning by lifting up through the heart and then getting taller through the crown of your head. Those two cues are going to help you get your head centered over your body in a much more efficient position. Efficiency is really everything in something like walking. We don't want to lose energy, waste energy, and destroy our joints when we're walking, after all. So you want to think about lifting your heart. It comes right up from the pubic bone, and then lifting through the crown of your head and feeling the balance between the front and back body. Of course, you're going to let your arms swing and your upper back rotate slightly. There's a little bit of rotation in the pelvis, but we want that long strided, nice fluid walking. That is going to be really good for your neck. You're getting a little bit of impact forces. You're getting your head balanced over your body so that the front and back muscles can work together to keep you upright and erect. Always think about getting taller. I find that a really useful, helpful cue. You'll feel that right through the center of your body, right from your pelvic floor, your diaphragm, your heart, and the crown of your head. Get taller, walk like you own the place, and walk with your feet straight. Good luck.